In a previous video, we talked about how tendon injury and tendon damage tends to cause disorganized patterns in the collagen fibers of tendons. And I want to go into a little bit more detail of what happens there and why maybe the more proper term for this is tendinosis and not tendonitis. So as I said in a previous video, this is what a healthy tendon looks like under a microscope. This is what a mildly injured tendon looks like under a microscope. And this is what you would see in a microscope if you looked at somebody who's had chronic tendinopathy for 6 months, 8 months, a few years. You would see almost no recognizable pattern in the collagen fibers being laid down. I have another example of that over here where you can see healthy person, nice aligned collagen fibers, here. Severe tendinopathy, you see these breaks in the fibers and very poorly arranged or completely misarranged collagen fibers. One other thing that is relevant here that is not in the picture, something that you do not see under microscopes, is inflammatory cells. So that's very interesting. You may, I don't know how familiar you are with your Greek roots, but the itis, as in tendinitis, suffix implies inflammation. And inflammation comes from inflammatory cells. And so if you take a little sample of an area that's inflamed, like say the tissue around an ankle after an ankle sprain when it's really swollen, and you do a special staining procedure, you will see these inflammatory cells sitting around inside the tissue, causing that inflammation. What's interesting about tendon injuries, even chronic tendinopathy, is that you do not see really any of those inflammatory cells. I use the other, so the common terminology now, or the recommended terminology, is tendinosis. This osis means like degeneration, without necessarily implying inflammation. The other term you'll see, and you've probably heard me use already, is tendinopathy, and that just means disease or degeneration, right? So a pathologist is somebody who studies disease. So that's maybe the more correct terminology. That being said, you'll see and hear people use the term tendinitis all the time. Regardless, I will try my best to use the correct terminology here, and it's useful to understand that this is a degenerative issue of damage, not an issue of inflammation. And that has important implications for how you would go about rehabilitating a tendon injury. So it turns out one of the best ways, if you have a tendon that is had healthy collagen fibers and now you have this big disorganized mess in the middle because somebody was doing too much training and got injured, the best way to address this is with a controlled doses of exercise, especially eccentric exercise seems to be more helpful than concentric exercise. People aren't 100% sure why. But the effects of that seem to have to induce healthy forms of new collagen synthesis and help reduce some of this disorganized collagen fibers. This image right here is a very cool example of it. This is an ultrasound image of a person with Achilles tendinopathy. This is like pre and post physical therapy. I think 16 weeks of eccentric exercises under the supervision of a PT. And what I have outlined in red here is the ultrasound images are really hard to see what's going on, but this is the thickness of the Achilles tendon. So we are looking at the sagittal plane again. So the Achilles tendon is like going along like this, and notice it's very, very thick and swollen, but not swollen from inflammation, swollen because there's all this disorganized collagen fibers. And then following this successful rehabilitation protocol, the tendon is not as thick anymore, and presumably if we could look under a microscope, we would see healthier better arranged tendon fibers. So that is the maybe the microscopic level of how tendon damage and tendon repair works, and maybe now you know why I'm careful to say tendinosis, tendinopathy, and not tendinitis.